Okay. Dear colleagues, friends, hello. My name is Yulia. I'm so scared because my friends should help me with translation, and now she's in Ukraine, and sorry me about my English. And maybe 2 words about my organization, only 2 words. YEVA is only Russian network of women, and they close once affected by HIV, TB, hepatitis. It was established in 2010, and it consists 8 organizations and about 300 people from 18 Russian regions. Our mission is to improve the quality of life people affected by epidemics. About our project, maybe main question for us: how many pregnant women have history of drug use in Russia? And official statistic about women who use drugs in Russia is extremely scarce. About 60,000 women are registered as injecting drug users. This is it not additional epidemiological information or estimates about women who use drugs? It's clear that the majority of women drug users are of reproductive age. How many of them are getting pregnant each year and give birth? There is no official data about it. This shows how not enough attention is paid to this group of women. Our project was driven by these 3 main questions. What is going on with pregnant women who use drugs? How does the system address their unique needs? Who is responsible? Whose patient is the pregnant women who use drugs? Our first objective was to document evidence. We knew we were going wrong, but we did not know details. About findings. First, we were able to determine intrinsic barriers to assessing medical care among pregnant women who use drugs. And these barriers include isolation, distrust, and maybe it's more important that some of these barriers can be addressed by NGO, even without the support from healthcare system. NGOs can develop specialized outreach and services for pregnant drug development women. But the other findings include the existence of system-wide barriers, what are much harder to address. System-wide barriers are the main problem for pregnant women who use drugs. The system is not fit to work with patients with multiple conditions that is the legacy of Soviet health system. First, healthcare services are fragmented and high threshold. Second, there are no guidelines on managing pregnant women who use drugs and usually have other health conditions like HIV, hepatitis, sexual transmission disease. And you may see, this is example, maybe illustration how fragmented the healthcare system is. We mapped health and social services for pregnant women who use drugs. A typical pregnant woman who needs help is at the bottom of this map. Can you imagine how long it takes to navigate this system? All those intrinsic barriers and especially system-wide barriers result in poor health outcomes. Our study found that there is inadequate prenatal care for women who use drugs. Women with HIV start receiving PMTCT late in their pregnancy. Almost all women in our study have tried to address addiction problem during pregnancy that shows an extremely high level of their motivation. The system failed the women as practically nothing is offered. Women who use drugs are being sent from one specialist to another, usually with no coordinate among the doctors. On top of that, doctors often have judgmental attitudes toward women who use drugs during pregnancy, and they are also afraid not to be able to help such difficult patients. Add to this mix the lack of guidelines on managing pregnant drug-using women, and you will see that we saw a pregnant drug-using women fall through the cracks. This result in poor pregnancy outcomes. Preventable complications and poor pregnancy outcomes. You see 29% had miscarriage and 80% had preterm delivery followed by neonatal death. Next findings. It's our local partners in the 3 cities. And maybe 4 main components: development, specialized services for pregnant women who use drugs. Next, training physicians. Third, encourage interdisciplinary, multidisciplinary team coordination among the doctors. And last, establishing referrals among clinics, NGOs, and drug rehabilitation centers interested in helping pregnant drug-using women. And how example, maybe you may see a situation in Tomsk, what changes after project, after project our colleagues. And if we are talking about advocacy in Tomsk, you see slide Tomsk, what changes and what happened after. You may see a big job, and this job finished, and now Tomsk had protocol on managing drug-dependent women through pregnancy, childbirth, and early motherhood. And maybe about next step, now we translation to more focused advocacy. There are other steps what we have already taken, but we plan to work on the harder and actively use evidence that we have collected. So we have some glomery present when the pregnant drug using, this is example, and maybe last slide. So we have some glomery present when the pregnant drug-using woman is facing alone a very scary healthcare system. And we have a vision of a very bright future when system is actually adapting to the needs of the women. We are ready to work within and around this system. Thank you for your attention.